I'd call this regular meeting to order. Please call roll.
Mayor Quero.
Here.
Councilmember Swanson.
Here.
Mabry.
Here.
Fabian.
Here.
Newman.
Here. Please stand and join us in our pledge of allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Start off tonight with our public comment. I'm going to ask Chief Bruce to take the podium. There we go. Okay.
Mayor, City Council, City Manager, and everybody in attendance tonight, it's my honor tonight to recognize 3 officers of the Princeton Police Department. On July 19th, at approximately 1:09 in the morning, Princeton police officers, Sergeant Yeager, Officer Sorensen, and Officer Wolf, were dispatched to check the well-being of an individual whom had been sending pictures of a noose and other suicidal texts. Upon arrival, Officer Sorensen stayed at the front door and continued to see if anyone was in the apartment. Through a window, Sergeant Yeager could see someone lying on the floor with a cord around his neck. At the same time, Officer Sorensen noticed that the door was barricaded when shining a light through the window as well. Sergeant Yeager then proceeded to use force to gain entry through the front door, which was also barricaded and blocked by furniture. When entry was made, they worked their way to the bedroom where they found the subject hanging by a steel cord. The officers then lifted the subject out of the noose and laid him on the floor. He was still breathing at this time, and EMS was notified and was en route to the scene. He was still breathing, and during this time the subject was in and out of consciousness. Once EMS arrived, they took the subject to Perry Memorial Emergency Room. The professionalism in an emergency situation displays the officers' dedication to serve the public as law enforcement officers. Their selfless acts have saved a human life which otherwise would have been lost. Their actions set an admirable standard for all to follow. They are a credit to themselves, the Princeton Police Department, and the City of Princeton. Congratulations to all on a job well done. At this time, I'd like the 3 officers to come up front. Stand right over here. Get Sergeant Yeager first. It is now my pleasure to award the life-saving awards of the National Awards Program of the American Police Hall of Fame. These awards exemplify life-saving actions by police officers throughout the United States. And if I could have the city manager come forward. And we'll start with Sergeant Yeager. Each officer is given a medal, life-saving medal, as well as a tie clasp and a ribbon for their uniform, and a certificate from the Hall of Fame as well. Okay, and then Officer Sorensen. And Officer Wolf. And the certificate reads, the American Police Hall of Fame Life-Saving Award is hereby presented to these officers in recognition of their unselfish actions during an emergency situation which resulted in the saving of a human life. Your proper application of training, experience, and equipment exemplifies your dedication to the duty and preservation of life and service to your community. And this is for Officer Wolf.
very fortunate in a town the size of Princeton to have the police force that we have. I don't, a town our size, they have the force as well equipped and as trained as our officers are. We're second to no one. So we're very fortunate. Congratulations and thanks to all three of you. And everyone who wants to leave can leave.
How are you?
And now I'd like to ask Annette Schnabel to come up and give us her yearly report on Perry Memorial Hospital.
I don't know whether to be insulted or what with the way the room clears this morning. Or the gas is still there. Thank you, Mayor, and thank you, Councilman and Princeton City Manager, for inviting me to present to you tonight about the changes and things that we are doing at Perry Memorial Health Hospital to transform healthcare as we try to meet our community needs. Information I have to share with you tonight is both positive and negative, and we'll get to each of those situations as we go through. Okay. Yep. So we started out the year with, our fiscal year is with the city is May through April. So we started out our year with a new leadership team last year, and we're continuing to evolve our team. One of the things that we did is we wanted to focus on where do we want to go with our hospital and how do we need to make sure that we provide that care to our community. So one of the things we did is we identified what is it that is important to us as an organization as we move forward. And we identified that the Perry values are excellence, respect, community, and service. This is how we talk with our staff, how we work with our patients, and how we work with our physicians and other providers. And this is how we are looking forward to our future as Perry Memorial Hospital. So as we talk about what does that mean for us when we talk about respect and excellence, we want to recognize when people exceed expectations, show growth, have opportunities. A couple examples, one of our physicians, Dr. Davis, won the Rural Illinois Physician Excellence Award last year. He was recognized for that. Laura Seitz, our Department of Radiology and Imaging Director, became one of the rising stars in the Illinois Critical Access Hospital Network. Deb Wood was honored as one of the Illinois Valley Living Women of Distinction. As you all know, Deb Wood is very involved in the community from her work with EMS safety. She's a vital part of our preparedness for disasters for our future in the community. And then we also recognize our need to tell our story about what's happening in healthcare. We were featured on the PBS NewsHour as the rural representative to the nation of what is happening to healthcare. We were featured along with several hospitals from the Chicagoland area to talk about what's going on. We recognize that healthcare is a challenge for people from an access perspective, from a cost perspective, and we need to continuously improve those opportunities. Currently, healthcare as a nation is 19% of our gross domestic product, and that number continues to rise because of the escalating costs in healthcare. And we recognize the need to do something about that. We also recognize that that impacts our payers as well. And so as we look at what is our current system in our country and our state, we are currently working under the Affordable Care Act. Since our election of our newest president last year, there's been a lot of talk about repealing that and replacing that. So we faced a lot of uncertainty this past year as we looked at what would possibly come out of the different legislations. At this point, we are about 2 weeks away from the end of the ability for the reconciliation process to create the repeal of the Affordable Care Act. We still don't know. In this last 2 weeks, there's still an attempt to do that. There were positives and there were negatives in the Affordable Care Act. The Affordable Care Act truly did increase access to health care for people. Currently, our nation has about
9% uninsured, which is the lowest we have been in decades. But yet there are still rising costs in those who are receiving their care through the exchanges. So again, we recognize the need to try to improve our health care and reduce our costs. We do that through participation in accountable care organizations where we identify opportunities to reduce costs, improve quality of care, and improve access. One of the things that continue to be a challenge for us as well from a state perspective is our state budget. After 2 years of no budget, we do actually have a budget this year, which does mean we are starting to receive payments from the state, but currently we are at 220 days in AR from the state for patient care that we have provided to our Medicaid patients, meaning 220 days back in our payments. As I said, through the budget that was passed in July, we have started to receive some payments, but those payments don't match the month-to-month continued care we are providing to those patients. So that's always going to be a challenge for us as we look at those Medicaid patients coverage and the cash flow that we receive from that. Talking a little bit about service, we recognize that we need to improve the care that we provide to our patients as well as the access. So this was a year or so ago, we increased the space in our Perry Memorial Family Health Clinic in order to be able to provide additional access to our patients. This year, we spent time preparing for our expansion into Walnut and Henry, which we'll see the results of over the next coming years. So part of our growth this year in our Perry Memorial Family Health Clinic is we're featuring Dr. Christopher Blanford, who is now with us, and now it's been a year. And we're seeing the growth of his services. We have additional providers that have come to us in the last couple months as we continue to make sure that we have access for our community. Last year we expanded our hours in the clinic in order to make sure we have hours that are available to our patients. Another growth that we did this year is we acquired the practice of Dr. Mark Williams in February of this year. Acquiring this practice allowed us to integrate Dr. Godboli into the team, which now gives us 24/7 coverage for general surgery. So if a patient were to come to our emergency room after hours, 24/7, we do have a general surgery available to them, and they can be taken care of here in this community. 80% of the surgeries we do at Perry Memorial are outpatient. This is a normal trend that we see in healthcare now. More and more, as we look at our inpatient statistics, we'll see those declining as we see outpatient statistics rising. So just comparison, last year compared to this year, over 100+ growth in our outpatient surgeries. As we continue to move towards this year, we also wanted to have an additional growth, and so we were able to recruit Dr. Alan Van to join us. He did actually start May 1st, so that would be our new fiscal year, but the recruitment occurred last year. Dr. Van is the only minimally invasive spine surgery within a 75-mile radius. In addition to spine surgery, he is able to do general orthopedics, again, growing the access to that service in this area and reducing the number of people that have to travel out of town to receive that service. In addition to growing the team, there's concepts of improving care and quality while we're doing that. Last year, we contracted with a new emergency medicine provider in September. We had the Princeton Emergency Medicine Services join us, and they are providing excellent quality care to our patients. In addition to the emergency services, we acquired prompt care last year. So that is now Perry Memorial Prompt Care. And we'll see in the next slide that we have continued to grow in the prompt care service. We actually, as you'll see in this slide, the volume of ED visits declined from one year to the next, and that's actually a positive trend. May not sound like it, but it is. Because what we find is we looked at the cost of healthcare and studied where that cost is coming from. We have patients who are using the emergency room for primary care. And so increasing the access that we have done through the additional providers in our clinic, the extended hours in our clinic, and the addition of prompt care, we're actually able to reduce the number of people that have to use the emergency room as their primary care. So you'll see that information is reflected there as far as the number of patients that we receive there. I'm sorry, go back to this. Yeah, sorry. This slide also reflects the quality of the care that we provide in the emergency room. The Center for Medicare Services developed a survey that is a national survey that is called CAPS surveys. There's an inpatient survey and there's an ED survey. We started participating in this survey, and you'll see that our results have been very good in that we are ranked around the 91st percentile, meaning we do better than 91% of the hospitals in that survey for patient care. And this is about patients' perception of their care, the timeliness of their care, the communication that our providers give, the communication that our nurses give. So again, recognizing that we do provide quality care in our emergency room. So this then reflects the prom care. So as I said, we acquired that last year, so we had it for a full year of this fiscal year. We had over 6,000 visits to our prom care. Prior to acquiring the prom care, we evaluated the services that were being provided there, and this number exceeded those numbers as well as our estimates of what they could be should we take over that service. So even though we had a decline in ED visits, we had the increase in prom care because we have better access to care for patients. In prom care, we do not have access to the same CAPS survey that we have in the ED, so we do our own internal survey. We have questions of 1 through 5, and we have 86% 5 scores, 5 as our quality score in the prom care. As far as our financial statistics for the year, not quite as positive as the story we want to tell on the financial side, but from a volume perspective, we had about a 16% growth. So you'll see our the top line there is the number of inpatient days from 2015 through fiscal year 2017, the growth, the number of outpatient visits, and the amount of growth that occurred. As you again see, the percent of the services that we provide are outpatient, so about 82% last year of our services were outpatient. Again, that's that trend in healthcare as we see lower length of stay, more things being able to be done as an outpatient, and more of a focus on well care, chronic care management, and keeping people out of the hospital for inpatient care. This did result in a bottom line loss for us last year. As we look at the cause of that, one of the things that is a problem for us is that you know of, IMRF. We had to adapt GASB 68 this past 2 years, and our settlement from IMRF was in excess of the loss that we had for the year. Again, recognizing that we are working towards taking care of our community, we want to be the center of our service area. So we focused on how do we provide that through the other services that we provide to our community through multiple community educations. We had over 5,500 people participate in community education provided by Perry this last year. We provide free or reduced screenings. We have cooking classes, blood and food drives, and as well as other types of community involvement. Here are some examples. We did this past year a school health walk, where we go out to the different schools and we walk with the kids. We talk to them about food and nutrition and exercise. We have the In the Kitchen with Ashley seminars. They're monthly cooking classes where Ashley talks to you about different recipes and gets a chance also to taste some of the great food that she cooks. We participate in school pink nights, fundraiser events for cancer research. And we have an exciting Mam and Glam event, which will be extended this year as we work on the other community events. We also participated in other community events such as parades and working towards growing our services for the community. Again, we did have significant growth. We've got a lot coming up this next year. A huge piece of growing our services this next year is going to be related to the quality of care that we provide through our electronic medical record. We are implementing a new electronic medical record after 17 years with our previous one, which was getting behind the times and unable to keep up with the many changes that we need to do and be able to assist us with population health management. So we, as of June, kicked off a implementation, which is a full year process in order to make sure that we do it right. And so by May of 21st of next year, we will have a new electronic medical record. That electronic medical record actually will increase our access to information from tertiary care providers as we have patients that travel back and forth between services. We'll mention next year the results of our Walnut Henry Clinic openings that we did this summer. And then we are also starting diabetic services as well. And we've done several things this past year as well as upcoming to address mental health. Last August, we opened our Senior Behavioral Wellness Program. That's an outpatient geriatric mental health program. We added social services to our rural health clinics. We have a nurse practitioner that's in training to become a mental health nurse practitioner, and that's one of our services that will be added this next year. We're also going to be adding telehealth, mental health services as well. So continue to look at what are the needs of our community and how we can grow those into the future. Are there any questions that I can address?
And that, good. So our council person that attends the monthly board meetings is Jerry, is that correct?
That's correct.
And that's great, I appreciate that. So Jerry, we see you once a year, but if we had a question, certainly we could address Jerry if he's there. Okay, good. Would you say that you're fully staffed with your administration, your CEO? I know you're not your position, but your treasurer and all those positions you have, are you?
The answer would be no, or I wouldn't be here by myself tonight. We are actually currently recruiting for a CFO. We did have a departure of our CFO this summer, and we are in the process of recruiting. We do have an interim gentleman with us currently that's assisting us. We do have a recruiting organization working with us, and I'm in the process. One of the things I did this evening was had a phone interview with a candidate. So in the next couple of weeks, we hope to have some candidates on site that we'll be able to interview and hopefully select someone. We do have a quality interim that's helping us at this time. I did recently also hire a new chief nurse. We're very excited to have Debbie Mae Rickard join our team. She's a very experienced nurse and leader in healthcare, and is really providing some great leadership to our nursing team.
You know, I was looking at your financial results, and a couple of years, 3 years ago, I think you had like a $1.7 million loss. Last year you had a $700,000 and some odd gain, and this year 300 and some odd thousand. So when you combine the last 2 years together, you're down like $375,000, and so you're with all the healthcare challenges that you face, we are definitely in the hospital. You got the hospital tracking in the right direction. So
I feel like we're moving in the right direction. We have obviously some things that we're building on that cause us to have some challenges, but we are working towards the future.
And you're one of the few hospitals in the area that has 3D mammography.
We are, yes. That's one of the things that didn't get featured in this, but we added 3D mammography this year. That was in January. That's an expensive piece of equipment, but the benefits it brings to our community is it has a 15-month sooner detection of breast cancer. It also has a lower callback rate. So there's a certain amount of times when they do the initial mammography that the physician will see something they're not clear about, and so they have to call the woman back for additional studies. There's actually a lower callback rate with this unit as well because of that quality that it can give. It actually is like paging through pages to see the tumors and stuff. So we're very excited to have that. Our hospital foundation was a part of us being able to acquire that. It's about a $500,000 unit, and they gave us $165,000 towards purchasing that unit.
Great. Anybody else? Thank you, Annette. Good job. Appreciate it. And now we'll go any other public comment. Just need for you to state your name.
Chris Warren. I was just wondering, when Chief Root here, if anything was getting in the works of First Street and that, because just today, 4 cars within 15 minutes from the stop sign again. And, I haven't seen the police patrols as much as I used to in the daytime wise. So I was just wondering if there was other issues going on or what was happening with that,
Well, we have been running periodic radar out there. I mean, I don't know if you've seen them or not, but we have been picking that up. The other thing we're looking at is some newer equipment that we might use for like radar speed signs and stuff like that implement as well around there. So
I didn't know if I could do anything on my end,
right.
With video camera or something. I mean, I'm sitting home all day because of my neck and that. I have nothing better doing. You want to give me a video camera? I can videotape cars going through.
No, but we are working on it.
All right.
Thank you. Any other public comment? Okay, we'll go to the approval of minutes. Gary?
Mayor, I'd like to make a motion that we approve the minutes from our regular council meeting on Tuesday, September 5th, 2017.
Second.
Motion's been second. Any corrections? Call roll.
Council members Swanson.
Aye.
Mabry.
Aye.
Fabia.
Aye.
Newman.
Aye.
Mayor Querem.
Aye. I'll vote for approval of minutes to our city clerk. Invoices.
Okay, in the Department of Accounts and Finances, we have bills totaling $212,915.39. In the Department of Streets and Public Improvements, we have bills totaling $74,691.73. In the Department of Public Safety, we have bills totaling $173,472.73. And lastly, in the Department of Public Property and Utilities, we have bills totaling $2,395,615.85. Mayor, all council members present have confirmed their reviews of all invoices and now are submitted for disposition.
I make a motion that we approve the invoices as presented.
Second.
Motion's been second. Any comments?
Rachel, did you want to discuss the electric?
Yeah, I'll just make a comment. There was a $1.7 million check to First State Bank. That's actually the proceeds from the transfer station going to First State for the CD investment with them. So that's where that money comes in.
Any other comments? Call roll.
Council members Swanson.
Aye.
Mabry.
Aye.
Fabia.
Aye.
Newman.
Aye.
Mayor Querem.
Aye. Now go to regular business to our city clerk.
Next, we have a resolution number R-17-030, a resolution authorizing an agreement with Chamlin and Associates for engineering services to support an application for an Illinois Transportation Enhancement Program grant. Mayor, this has been reviewed by all council members and is submitted for disposition.
I make a motion that we approve resolution R-17-030, which is an engineering services agreement with Chamlin and Associates.
Second.
The motion has been second. I'll turn this over to Rachel.
Okay, just a couple of comments on this. So this is for the ITEP grant. The total amount that can be awarded for this grant is $2 million. What's included in the preliminary engineering is a grant request amount of $1.5 million. However, as we get farther along in this process and look at all the cost estimates and once some of the preliminary engineering comes back, there is opportunity if the council and if we decide, we don't want to get the whole $1.5 million since the cost share is 20%, we can always scale that back to $1 million. The portion that's included in this grant is the depot campus area. Some of the estimates that Chamlin has put together in that proposal are a little high just because of the earth excavation and what's required by the federal government when you use federal funds, including the environmental surveys. However, once you actually get to investigate that, we think those costs will go down significantly. Pleasant Street is also included, a portion of Pleasant Street is also going to be included in this grant. ITEP funds are very particular in what they fund. It's mostly for transit areas, beautification, historic preservation. So we tried to tie in the depot campus area as a transit area and then some of the side streets that join that with pedestrian and bicycle routes so that those things can connect and hopefully we would be awarded the grant. The grant is due December 1st. Typically these grants are every other year, so it really wasn't supposed to be due till next December, but they have decided to fund this grant for this year. So the thought is that we would submit it this year. If it's not awarded, we would be in a better position to submit it next year. A couple things, we can use local services as part of the match. So if we did some of our own sidewalks or some of our own work, that would be used as the 20% match. Same with preliminary engineering, we're still checking on that. In terms of this agreement, the only things that would be done this fiscal year from this agreement, cost-wise, would be the project kickoff meeting, the topograph survey, and the environmental survey. So just those three are the big things that take at least 6 to 8 months for review. So we do have funds to cover those this year in our engineering services line item of our budget.
That would be about 31,000.
Yes, that's correct. And also, one thing that ITEP will cover is stormwater management. And that'll be addressed with this plan too, especially if the depot lot was paved. There would be some stormwater management issues that would be addressed as well. That's all I have.
Thank you, Rachel. Any other comments? Call roll.
Councilmember Swanson.
Aye.
Mabry.
Aye.
Fabia.
Aye.
Newman.
Aye.
Mayor Querem.
Aye.
Next on the agenda is the first reading of an ordinance O-17-020. This is an ordinance authorizing a shared fiber and dark fiber license lease agreement between the City of Princeton and IVNet LLP. Mayor, the council has reviewed this document and is submitted for disposition.
I'd like to make a motion that we move or advance ordinance O-17-020 to its second reading.
Second.
Motion's been second, and I'll turn this over to Rachel.
Thank you. So this is an agreement, we had an agreement with IVNet that expired, I forget exactly when, but it's been expired for some months now. When was it?
About 5 years ago.
But it expired recently.
Oh, yes, yes.
Yeah.
Continued.
Yeah.
Sorry.
Thank you. So that agreement that we had expired, so this is a new agreement. Jeff Borelli from IVNet is here if we have any questions on this. This new agreement, we used to have two separate agreements, one for the shared and one for the dark, so we combined those into one agreement since basically the same thing, they had the same thing in them. The only difference was in the payment section. So the payment is increased from what we were currently getting. So it's 25% for the shared and then a third of the dark fiber based on their customers. And I think I just looked today, they have around 42 customers between the two, dark and shared fiber. This is commercial customers only, so businesses. There is one change to section 10 that will be made before the next reading, just a minor change. 10.2 is actually part of 10.1 and will be put before that, but we'll make sure to get that corrected before the second reading. So Jeff Borelli is here if you have any questions too regarding this.
Any questions from the council? I think we're set. Call roll.
Councilmember Swanson.
Aye.
Mabry.
Aye.
Fabia.
Aye.
Newman.
Aye.
Mayor Querem.
Aye. Thank you, Pete. And we'll go to city manager report.
I do not have anything else.
And I don't have anything except to say we just had a very successful Homestead weekend last weekend. Had a great concert turnout, great parade. Weather could not have been any better. A lot of work went into the Homestead weekend, always does, weeks leading up into it. So thank you to everybody in the city crew, city administration for everything that was done to get this all and have another successful Homestead. Any old business?
I got one item, Mayor. I just wanted to comment that about 6 weeks ago, I talked about businesses that had gone out of business or moved and left their old signage behind. We've done an inventory and discovered that there are 17 signs that are on Main Street, and we have done the research and have addresses and locations for the landlords of those buildings. They're going to receive a letter from the city within the next week, telling them they need to remove these signs in the next 30 days. So hopefully we can get these signs that have been abandoned off the buildings on Main Street. Thank you.
Is there any other old business?
If I could, Mayor, and Jerry, good job on that project. There's some of those signs that are embarrassing. They've been up there for 5 or 6 years in the vacant buildings. Some of them even a little bit longer. Anyway, real quick, if I could, the lure to get federal funds is a great thing, 80%, 20%. And as we continue to throw our lottery ticket in that hat to try to get that and spend money on engineering, I'm reminded about North Euclid Street and how we've spent, I think, close to $400,000 on engineering fees. And this is not against Rachel. This thing started like 3 or 4 years ago. And then we had the Safe Schools grant route. So if you would, Rachel, again, nothing against you, would you give us a quick update? How are we doing on North Euclid and how are we doing on the Safe Schools?
Sure. So I'll have more information hopefully this week. I talked to the state and the engineer for the Euclid project the last week. The State Historic Preservation Office is reviewing the 106.4F report that we were required to submit for the North Euclid project. I actually have that number memorized now, 106.4F. So, yeah. And they, it was in a stack, and they said, oh, we're going to get to it this week. So they reviewed it last week. They're supposed to have their comments to us by the end of this week. And in the discussions with them last week, they said, hopefully our comments are minimal, they think they will be, and then we can proceed with that project for a spring wedding. And then Safe Route to Schools, the state, I have to give credit to our district office from the state, they've been working really hard fighting for us on that because we had reduced the scope because the grant award amount was too much, if you remember, for what we could do ourselves, so we have to end up contracting that, which reduced the scope of the overall project. And the federal government is kind of still sticking to, they don't want to award it if we're not going to do what was originally awarded. But the state has been very proactive and has continued to be proactive in fighting for us, saying, you know, it wasn't realistic and now it is, and this is how we need to move forward. And we're setting up a meeting with the three of us in the coming weeks, the state, federal, and the city.
Very frustrating, I know. So I appreciate your hacking away at both those projects. So hopefully then North Euclid could be that we actually would be, you said, going out for bids for the North Euclid project in 2018. Yeah. And that would be subject to, again, it's 80-20% cost sharing. So it's still got to be the federal government's got to kick in the 80%. On that one, is there any state money on that one?
No.
Okay, so we have feds on the 80%.
But it's only 80% of what we have in our fund, which isn't 80% of the project. So it's actually our share of that project is more than 20%. It gets a little confusing.
Okay. And I know that project's been scaled back. We went from having the 9-foot walkway on one side, we've gone back to more conventional look to it. So, okay, well, I'm not negative. I just understand it's very painful on that whole thing. Ooh, thank you.
Any other old business? New business?
Yes, I have a very interesting podcast that I listened to from NCICG. I don't know if anyone caught it when they gave it to us. It's about local government laws. Are you tweeting into trouble, keeping it legal? It was from a law firm in Chicago, 2 lawyer representatives. Ansel Blink was the law firm. And I, of course, went immediately to the city's Facebook page and noticed a few things that we have to do. And Mayor, your Facebook also. Private messaging could be subject to FOIA. We have to record retention. We're putting your mercy is at the mercy of Facebook and Twitter for retaining this stuff. They said a big thing is archiving. I don't know if we are archiving our Facebook or if you are archiving yours, Mayor. It is a must. You could hire a firm, you could do it yourself. An easy way to archive is put it on like Microsoft Word first and then post it is one of the examples. But if you comment on it, then you have to get back into archiving it. On our city's Facebook, I know there are no policies. Under About, you should put a policy just like open meeting policy, no obscenities, no threats, no, whatever our policies are for an open meeting. That way, if someone is belligerent, you can delete their comment. If they're a repeat offender with, like say, John's advice, we may be able to block them. You cannot delete or block a comment because it doesn't agree with you or you do not like the person. That is a violation of their First Amendment rights. It's been upheld in Virginia in 2 different courts. And liking outside the city business could be dangerous. Not legally, but ethically. You may look like if the city is liking something that you are promoting that business over this business. It was very, very interesting. If anyone still has it, you can look it up. A lot of legal things, they were saying that legal is finally catching up to the social media. So I think it's some things that we should be paying attention to. But I would like to see, Rachel, you start archiving our stuff. And they said, I don't know how to do it, but they said it's very simple. Do not have a part-time employee do it, have a full-time employee do it, and it may require an hour or 2 a week.
Okay, any other new business? All right, any public comment? I will entertain a motion to adjourn this meeting and go to our next.
I'd like to make a motion that we adjourn our regular meeting and then reconvene for our next council meeting on Monday, October 2nd, 2017 at 7 o'clock here at City Hall.
Second.
Motion's been second. Call roll.
Councilmember Swanson.
Aye.
Mavry.
Aye.
Fabia.
Aye.
Newman.
Aye.
Mayor Querem.
Aye, thank you all for attending, and this meeting is adjourned.